I'm Jordyn, and my group was Sydney and Erica, and we did ours on cerebral palsy. Okay, just give me some time to figure this out. Click. Over, click, arrow. Okay, cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. And we kind of chose this one because my uncle actually has cerebral palsy, so it's kind of near and dear to my heart. Okay, so there's two different kinds of cerebral palsy, and there's congenital and acquired. And so the first one is it can be from like low birth weight, and so children who weigh less than 5.5 pounds at birth, and then especially if they're lower than 3 pounds, they have a higher chance of having CP. And then another one is if you have premature birth, so if you're born before 37 weeks, you also have a higher chance of getting CP. And then if there's multiple births, so if you're a twin or if you're a triplet, you also have a higher chance of getting CP. And then there's also medical conditions of the mother, so if the mother has thyroid problems or has an intellectual disability or things like that, you also have a higher chance of CP. And then just birth complications, so like detachment of the placenta or just problems with the umbilical cord during birth that can disrupt the oxygen, that you also have a higher chance. And and then there's acquired CP, and then they kind of have the same symptoms that can cause it, but then it's also infection. So infection of the mother during pregnancy can cause the baby to get CP, or injury to the brain, so head injuries, and that's usually after birth. And then there's problems with blood flow to the brain, and just also the same with that one, so preterm, premature birth, or low birth weight. Okay, so symptoms is exaggerated reflexes, floppy or rigid limbs, involuntary motions, and movement and coordination problems. So like my uncle has a hard time walking without like crutches or canes. So he's getting older, so a lot of the times he just he has like a scooter that he rides around in rather than trying to walk, because it's just getting harder and harder for him to do. And he doesn't speak the best, so another symptom is slurred speech. I mean, I can understand him pretty well, but sometimes it can get kind of hard. So as nurses, some of the assessments that we can do is impaired physical mobility, so we can just look at that and see, like, are they walking funny and things like that. So they often have like an imbalanced nutrition, so they tend to weigh less than the body requirements for people their age and their height. Impaired verbal communication, so just assess like the way they talk and things like that. And ineffective therapeutic remnant management, risk for injury, risk for delayed growth and development, so they tend to grow and develop a lot slower than normal people their age. So in this picture, so you can see that it's caused by, a lot of it is caused by brain injury or brain malformation that occurs before, during, or immediately after birth, while the infant's brain is still under development. So in the image on the left, that is a healthy child, so the gray matter is pale gray and the white matter is dark gray. But in the image number 2, the red arrows show the scarring over the central gray matter, leading to stiffness and problems in the coordination of movements. So you can just see where the red arrows are pointing there. So there's different steps that can be, that people take in order to diagnose CP. So the first one is developmental monitoring. So all you do is track the child's growth and development over time. So this can be done by just asking the parents if they have any concerns about the child's development or anything like that. And then if there are problems or if the nurse has concerns, then they move on to developmental screening. And that's when a short test is given to see if the child has specific developmental delays, such as motor or movement delays. And they tend to do these screenings at 9 months, 18 months, 24, or 30 months, because when a child is 9 months of age, many issues, that's when you can start seeing the delays in some of the infants and babies. And then if there are a few problems or concerns, then they do another test 3 months or 9 months later, and then they just kind of keep tracking it a little bit more. And then if there still are concerns after the 24 or 30-month checkup, then they move on to developmental and medical evaluations, which is when they diagnose a specific type of disorder. But then they also, in this stage, a lot of times when you have CP, you also have seizures and hearing problems or speech problems, and so then they diagnose these things as well during that stage. So there is no cure, but there is treatment. So you can go to therapy, which can just help with muscle coordination and movement and stuff. Adaptive equipment, which is all the braces he's wearing here, or my uncle uses crutches and a scooter. And then drug therapy is just medications that they can use, a muscle relaxant. And then surgical interventions would help. Surgery can correct or improve movement and alignment in the legs, ankles, feet, hips, wrists, and arms. My uncle has never had surgery. Prognosis and follow-up. They live long, happy, quality lives. It doesn't really affect their life expectancy. And one thing to note is that it does not progress. So once you have CP, it's probably going to stay that bad or not that bad, depending on how you have it. So it doesn't worsen over time. How you have it is how you're going to have it. So there are ways that some doctors think that you can prevent CP, but not 100%, just some things that you could do. So getting vaccinated against certain diseases that could cause fatal brain injury. So when you're pregnant, before or during pregnancy, you should have the certain vaccinations so your child doesn't get brain injuries that can cause CP. And just the healthier you are in a pregnancy, the less likely you are to get infections that could affect the baby. And just regular checkups, of course, to your doctor if you are pregnant, to see the risks for your unborn baby. And then prevent head injury. This can be once the child is born, so a car seat or a bicycle helmet, when they're first learning to ride bike, or safety rails on beds so they don't fall off and hit their head. And then avoid alcohol, tobacco, and illegal drugs. These have been linked to CP, but they do not know the specific cause.